Assalamu alaikum and welcome to this week's Journal Club, where I'll be presenting a paper published in the IAJ by Lee and others in 2026 titled Prevalence, Classification, and Factors Associated with Cemental Tears, a retrospective observational cross-sectional study in a postgraduate endodontic clinic. So the objective of this study was to determine the prevalence of cemental tears using high-resolution CBCT and digital periapical radiographs to categorize identified cases using a specific classification system and to evaluate potential factors associated with their occurrence. They had a total sample size of 445 teeth from 445 patients, screened from an initial 575 subjects. For the methodology, they took the clinical records and radiographic images. Both periapical radiographs and CBCT was reviewed, and cemental tears were identified and classified based on either classes and stages, class 0 to 6, and stages A to D. And they identified potential factors, almost 30 factors, associated with this. For the results, the prevalence of cemental tears was 5.6%, or 25 out of 445 cases, and periapical radiographs had a sensitivity of 0.6 and a specificity of 1 compared to CBCT. And most cases were classified either as class 2 or 4, which was 76%, and stages C or D, which was also 76%. And the significant factors that they identified which were associated with the tears included incisors, increased tooth mobility, severe crestal bone loss of more than or equal to 70%, and adequate root filling quality. They concluded that cemental tears are a critical differential diagnosis in endodontics, as they often mimic perio-end lesions, and clinicians should be vigilant when treating mobile incisors with severe bone loss, and that also CBCT is essential for accurate diagnosis and effective treatment planning. So the good thing about the study is they used high-resolution, small field of view CBCT, which improved their detection over previous studies. They had excellent intra-observer reliability as well. However, it is a retrospective design which may lead to underestimation due to incomplete records. And the occlusal interferences was also not studied due to the lack of documentation. So all in all, this study highlights that while periapical radiographs are helpful, they missed almost 40% of the cases identified by CBCT, reinforcing that three-dimensional imaging is the gold standard for this specific pathology. Thank you very much.